Irritable bowel syndrome, IBS, is a common yet complex disorder affecting the gastrointestinal tract, impacting millions of people worldwide. With its unpredictable symptoms like abdominal pain, bloating, and altered bowel habits, IBS can significantly reduce quality of life. But what causes this elusive condition, and why does it affect people so differently? How can individuals with IBS find relief amidst the uncertainty? This video explores the intricacies of IBS, from its varied presentation to the latest treatment options. Join us as we delve into understanding this perplexing condition and uncover strategies to manage its impact on daily life. Make sure to stay until the end to find out all the best information, and remember, at Beyond Living, we provide the best information and actionable and functional guides for all facets of healthy living, vitality, and fitness. Also, check out the awesome products that are running exclusive, limited-time deals just for our viewers here at Beyond Living in the description and in the top pinned comments that we recommend for all our viewers for vitality, healthy living, and fitness. Like, comment, and subscribe as it greatly helps the channel. So what is IBS? Irritable bowel syndrome, commonly known as IBS, is a functional gastrointestinal disorder characterized by a group of symptoms affecting the digestive system. It's one of the most frequently diagnosed gastrointestinal conditions, yet it's also among the most enigmatic. IBS does not cause visible damage or inflammation in the intestines, making it difficult to diagnose and understand. The hallmark symptoms of IBS include abdominal pain, bloating, and changes in bowel habits, such as diarrhea, constipation, or a combination of both. These symptoms can vary in intensity and duration, with some individuals experiencing mild discomfort while others endure severe, debilitating episodes. Notably, IBS does not lead to serious complications like other gastrointestinal diseases, but it can profoundly affect quality of life due to its unpredictable nature. Researchers categorize IBS into different types based on predominant bowel habits: IBS-C, constipation; IBS-D, diarrhea; and IBS-M, mixed, with alternating constipation and diarrhea. This classification helps in tailoring treatments to individual needs. Given its complex nature, diagnosing IBS involves careful consideration and the exclusion of other gastrointestinal conditions, which we'll explore in the next section. Understanding the diagnostic process is key to effective management and, ultimately, finding relief from IBS symptoms. Diagnosing irritable bowel syndrome, IBS, can be a challenging process due to its lack of visible abnormalities and its overlap with other gastrointestinal conditions. The first step is typically a thorough review of the patient's medical history and a detailed discussion of symptoms. Healthcare providers, often gastroenterologists or primary care physicians, look for patterns of abdominal pain, bloating, and altered bowel habits, which are hallmarks of IBS. The Rome-IV criteria are a widely accepted framework for diagnosing IBS. According to these criteria, IBS is characterized by recurrent abdominal pain at least 1 day per week in the last 3 months, associated with 2 or more of the following: changes in stool frequency, changes in stool form, such as loose stools or hard stools, or relief of pain with defecation. Before confirming a diagnosis of IBS, physicians must rule out other potential causes of similar symptoms, such as celiac disease, inflammatory bowel disease, IBD, or colorectal cancer. This process often involves blood tests, stool tests, and possibly endoscopic procedures to exclude structural or inflammatory abnormalities. Once the diagnosis of IBS is established, the focus shifts to identifying potential triggers and exploring treatment options. In the next section, we'll dive into the underlying causes of IBS, offering insights into why this condition affects individuals so differently and what factors might contribute to its development. Understanding these causes is crucial in devising effective treatment plans and improving quality of life for those with IBS. The exact cause of irritable bowel syndrome, IBS, remains elusive, with research suggesting that it's likely the result of a combination of factors. One key area of focus is the gut-brain axis, which describes the bidirectional communication between the gastrointestinal system and the brain. Disruptions in this communication, potentially due to stress or anxiety, can lead to changes in gut motility and sensitivity, contributing to IBS symptoms. Another significant area of study involves the gut microbiome, the diverse community of microorganisms residing in the intestines. An imbalance in this microbiome, known as dysbiosis, has been associated with IBS. This imbalance might lead to increased gas production, changes in bowel habits, or heightened sensitivity to certain foods. Genetic factors also play a role, with some studies indicating that IBS may run in families. However, it's unclear whether this is due to genetic inheritance, shared environmental factors, or both. Additionally, some individuals develop IBS following a gastrointestinal infection, known as post-infectious IBS, suggesting a link between infections and the onset of symptoms. While these factors contribute to our understanding of IBS, they also underscore the condition's complexity. With so many potential influences, treatment approaches must be individualized. In the next section, we'll explore various treatment options for managing IBS, focusing on a combination of lifestyle changes, dietary adjustments, stress management, and medication. Understanding these options is key to finding effective relief from IBS symptoms. Treating irritable bowel syndrome, IBS, requires a multifaceted approach, as symptoms and triggers can vary widely among individuals. The goal is to manage symptoms and improve quality of life. Treatment plans are often tailored to the specific type of IBS, whether it's IBS-C, constipation, IBS-D, diarrhea, or IBS-M, mixed, and may include a combination of lifestyle changes, dietary modifications, stress management techniques, and medications. First, lifestyle and dietary changes. One of the first steps in managing IBS is making lifestyle and dietary adjustments. For many people, certain foods can trigger symptoms. A popular approach is the low FODMAP diet, which eliminates foods high in fermentable carbohydrates, such as certain fruits, vegetables, and dairy products. This diet can reduce bloating, gas, and abdominal discomfort. However, it's important to follow this diet under the guidance of a healthcare professional to ensure proper nutrition. Next, stress management. Stress and anxiety are known to exacerbate IBS symptoms, so stress management techniques play a crucial role in treatment. Practices like mindfulness, meditation, yoga, and relaxation exercises can help reduce stress and, in turn, lessen IBS symptoms. Cognitive behavioral therapy, CBT, is another effective approach, providing strategies to cope with stress and reframe negative thought patterns. Additionally, if needed, medications. Medications can be used to manage specific symptoms. For IBS-C, laxatives and stool softeners can help with constipation, while antidiarrheals are commonly prescribed for IBS-D. Antispasmodics may reduce abdominal pain and cramping, while newer medications, like lidocaine and alushatelin, target specific IBS types. These treatment options offer a comprehensive approach to managing IBS. However, managing IBS is a continuous process that requires monitoring and adaptation. In the next section, we'll discuss practical tips for living with IBS and strategies to handle flare-ups, providing a guide for navigating daily life with this condition. Living with irritable bowel syndrome, IBS, involves more than just managing physical symptoms. It requires a holistic approach to maintain quality of life despite the condition's unpredictability. People with IBS often find that creating routines, learning coping strategies, and fostering a supportive environment can make a significant difference in their day-to-day experiences. Daily routines and self-care. Consistency in daily routines can help reduce stress and provide stability for those with IBS. This includes establishing regular meal times, incorporating physical activity, and prioritizing sleep. A balanced diet, rich in fiber for some and low in FODMAPs for others, can minimize symptom flare-ups. It's also crucial to stay hydrated, as proper hydration aids in digestion and bowel function. Stress reduction techniques. As we discussed before, stress can exacerbate IBS symptoms, so adopting stress reduction techniques is key. Practices like mindfulness, meditation, yoga, and deep breathing exercises can help maintain a calm mind and reduce gastrointestinal distress. Cognitive behavioral therapy, CBT, has also proven effective in addressing the anxiety and stress often associated with IBS, providing tools to manage psychological triggers. Building a support system. A strong support system can greatly enhance the experience of living with IBS. This might include friends, family, support groups, or online communities where people with IBS share experiences and advice. Having people to talk to and share challenges with can reduce feelings of isolation and provide valuable insights. Managing flare-ups. Despite the best efforts, flare-ups can still occur. Learning to manage them involves identifying personal triggers, using relaxation techniques, and having access to medications that can provide relief when needed. It's also helpful to have a plan for managing symptoms in public or during social events, ensuring that IBS doesn't become a barrier to an active life. In the next section, we will discuss when to seek further medical advice and the signs that indicate a more serious underlying condition, emphasizing the importance of ongoing communication with healthcare providers in managing IBS. Although irritable bowel syndrome, IBS, is generally not life-threatening, certain symptoms could signal a more serious condition. If you experience unexplained weight loss, persistent bleeding from the rectum, severe abdominal pain, or symptoms that abruptly worsen, it's crucial to seek medical advice promptly. These signs could indicate underlying issues like inflammatory bowel disease, IBD, or colorectal cancer. Regular communication with healthcare providers ensures that you receive appropriate care and that other conditions are ruled out. Staying informed about your health and reporting changes promptly is key to managing IBS effectively and safely. IBS can be a challenging condition to manage, but understanding its complexities and adopting a personalized approach to treatment can greatly improve quality of life. By focusing on dietary changes, stress management, and effective medication, many people with IBS find significant relief from their symptoms. However, ongoing communication with healthcare providers is crucial to ensure a proper diagnosis and effective treatment plan. If you or someone you know experiences IBS symptoms, take action by seeking medical advice and exploring a combination of lifestyle changes and professional guidance. Your journey to better gut health starts with a commitment to understanding and addressing IBS.